just to finish up for the next just 10 minutes or so, I've just pulled off a couple. I think the first one that I've chosen here, it says one of the people here has asked, has the issue of legalisation gone totally quiet, and is there any evidence base? I don't know, maybe why am I thinking of you, Pete, for that? I don't know, you've touched on it, I thought that the way you described it, the nuclear button, I've never heard it described that way before, and it really made me think, you know, this huge issue's been created partly through that, but has it gone quiet? Is there an evidence base?
It'll never go quiet. It'll rumble along in a non-linear way, probably for the next 50 years. It's difficult. It's not as black and white as. I think the approach we've got in this country is quite a pragmatic. You know, we have industrial rollout of methadone. Well, that's quite progressive. The way the drug laws are enforced is fairly progressive. What's the answer to the question? No, it's not gone away, but I think that it's not such a binary issue, and I think the English response isn't very binary either.
Yeah.
And I think that it's going to rumble on, isn't it? And where we get to, nobody knows.
Andrew, have you got any ideas in terms of the evidence base?
Well, I think it really depends on what you end up with if you change the law. I mean, you know, there's a variety of ways that are being tried out at the moment, aren't there? So in the States, there's a number of states that have taken a view that they want to legalise cannabis. In Portugal, you've got the decriminalisation of possession. So there's, and there's a Dutch model as well, isn't there? So there's a kind of variety of ways, and the Colombians are now looking at again this. So I think there's a number of ways that people are thinking about it. But what you end up with is, one way or another, you're trying to control the access to a set of drugs, whether those are alcohol or what are currently illegal drugs in this country. And you know, how you implement that, you know, whatever it is, whatever that legal framework is going to be different and going to have different effects. And I think, you know, the advocates for law reform make a number of good points, but I think as do a number of prohibition people. I think it's unlikely that the law is going to change anytime soon.
In the next 50 years.
Yeah. I think, you know.
So sorry to get, but how does that, on a crime and policing front, what's your view on that thing about the legalisation? I suppose we're talking about cannabis, for example, as one of the big sort of media things. Some countries it's decriminalised for possession, others not. What is there a sort of within? Are you allowed to tell us within the ranks?
You're outside of my scope. I'm sort of more alcohol, but from a personal perspective, I think society is confused, doesn't know what it wants. I think that's reflected in the answers given. I think if you look at alcohol, that is lawfully available, it is widely abused. If you look at the legal high market, that is rapidly developing to try and find niches where it can operate. It's a complex mess, and I don't think either a legislative or a social health solution, either will work. I think there's some balancing in the middle that society needs to find what it wants. Woolly, I'm sorry.
Okay.
Interestingly,
Anna, did you have a
No,
I've got another question for you. Sorry,
where they've introduced in California, I think there's been research on where they've had medical marijuana, and that certainly seems to have increased prevalence amongst young people.
It's definitely relationships between access and use.
Yeah, so I think, you know, however change happens, and you need to be kind of conscious of unintended consequences.
I like this one because something that we've been really campaigning for here at Mentor. How do we get drug and alcohol prevention into PSHE? It's got to be you first.
It's all been quite disappointing, hasn't it? You know, in terms of where we had our great hopes, and now it's not statutory.
Yeah. We were that close.
We were that close. We really were. But I don't know. I don't think that the war's won on that one. I think that's going to rumble on. I think there's been still a lot of dissent about it. I think that one of the most powerful tools that you can offer a school to make the argument that they need to be doing some kind of PSHE is to give them some data about what their young people are involved in. And that would be my answer in terms of if you want to quickly get them to sit up and take notice. So it's useful to promote health profiles for the area and the work that doing public health and all of that. But also locally for us, there has been a knock-on effect from using our D-Vibe survey, because it's kind of easy to do as well, to get out there. That it's bringing back data not only about substance use but also about sexual health and risk-taking. And it's very, very difficult when a school sees that kind of data coming from its young people to then say we don't have time to do any educational programmes. So I think in the short term, to try to get schools to take some to get schools to do some baseline data may in part be a way to kind of cover this gap. And meanwhile, hopefully they'll come to their senses about giving the impression to schools it doesn't matter and that everything else can take greater priority.
Can I just probe on that? Because when you were saying earlier, it struck me that one of the biggest sort of peer pressures for people to do things applies to the schools themselves, and that if they're actually doing what you just explained. Because I kind of feel when I hear about data, I kind of like glaze a bit, and I kind of think, but one is explaining the evidence, but the other is actually the practical. Because I think your model of just doing it and then others following is a very powerful one, and I wonder whether it's actually a mixture of both. I don't know. Peter, have you got any issues on the PSHE issue in general? Is that something that comes up at Public Health England, or is it something that crosses your desk? No, right.
Well, not very well. No. I mean, I think it's more questions to be asked. I don't think it's the end of the game.
Andrew?
Well, I think if I understood the question, which is how do we get it into PSHE, I think that the PSHE is good in as a vehicle for doing drug education rather than science, because it allows pupils at its best to look across a number of factors or issues that are happening in their lives now or in that they're anticipating. And actually, drug and alcohol use doesn't happen out of context, particularly alcohol use. If you look at that, the change in where young people are drinking over the last 10 years has been away from drinking on the streets, because Dave and his colleagues have been out there telling kids, and nicking their alcohol, which is, good stuff. So they've moved inside, haven't they? So they've changed where they drink, and house parties are where that happens now. And
much better potential for risk.
Well,
behaviour in a house party.
Absolutely. So, the 10% or 11% of young people who've been say that they've had unprotected sex as a result of drinking. Okay.
Yeah, Brooks said about 33.
Wow.
So they had their first entirely unplanned sexual experience after they've been drinking.
Did you say 33%?
I think that there was in one cohort, it was very high, that their first sexual experience.
I think what we need to do is we need to help PSHE teachers to stop thinking of them PSHE as a topic-based subject. This week we do sex education, next week we do drugs, and the week after that we'll do something about healthy eating. And I think we have to be thinking about, life course, experiences. What is it that you want to do with your life, as much as teaching them about the facts about drugs. And this week we'll have somebody in and they'll teach that.
Can you keep mind?
Yeah, sorry, David.
All I was going to add was, I think, and not directly related, but we've been trying to do some work around bullying in schools and getting some people into schools. And I think the link for me is you need to sell it to the school's management team so that they want it in their school, because it assists them delivering the objectives they're measured on.
Correct.
So if you start talking about better attendance, less exclusions, better attitudes in class,
Staff retention.
More staff with a better morale. Teachers are happier teaching kids that want to learn, and if the disruptive element, so if you sell it on that basis and say, if you put this in, and you'll get more interested, motivated young people, and they might be more willing to have it. And
fascinatingly, when myself and Andrew were at the European Society of Prevention Research last month, and a very prominent researcher was talking about her work on the good behaviour game. Random controlled trials, 20, 30 years of history and evidence behind it. Just saying the biggest single barrier to getting it to roll out, to getting it to some sustainability, was head teachers. And I think that comes right back to how you then go about use, because what we're now talking about is actually sales and marketing. 9 out of 10 cats prefer it, sort of stuff, and that idea of saying to teachers, I'm not going to do it, no, I'm not going to do it, some are doing it, oh, what are you doing that for? Oh, can we do that? It really does sometimes come down to that level. So I think the PSHE issue will rumble on, but I do think what Andrew was saying as well about how it's treated, not so much as a subject matter, but as a putting aside 3 or 4 or 5% of time in the school curriculum where you have this sort of stuff is probably a more flexible way, because you can plug that if the stuff isn't there, but you've also got it if it is there. And I think maybe the labelling of it is maybe a hindrance as well.
I wonder if it just might be worth adding just on that as well, that Ofsted have been very clear in their recent reports that schools should move towards a risk curriculum, a risk recognition curriculum, which has its kind of it has a sense of a targeted PSHE curriculum to it, doesn't it? And maybe, I don't know, there is still things there that will drive schools, and because it's been mentioned in terms of Ofsted, that gives another little push for them. But it's clear that you shouldn't be ignoring these social issues, but there is no push given about how to do that.
How do you convince teachers, they say we ain't got time to deliver these programs, we're all busy, we've got all these stresses, where I'm working at inner city kids, some of the teachers are trying to work with, there's questions around, are these teachers kind of qualified, teachers seem to be younger than they normally are, than they used to be, so how do you kind of convince teachers who's already overwhelmed with work, so how do you get around that?
That's probably a lot of the work that we've done, I think.
I think it's data.
Yeah.
I think,
data.
And I think that's a really good starting point for any conversation is, well, this is your school or this is your community. These are the current set of risks that might apply to them, and how are you currently approaching it. But every program that I've ever come across, without leadership engagement, the point that Paul's making, without leadership engagement, whether it's the resilience program in the US Army or a PSHE program in a school, or whatever it is, IBA in A&E, without leadership saying this is important to us, you're going to get those sorts of answers.
A direct answer to that question: take that person out of that school for a half a day to a school that's getting some interventions and get them to talk to the staff. That will make a big impact. Some of those schools, when they say they haven't got the time because they're working in a particular framework. They've got classroom assistants in because they've got disruptive kids, etc., that sort of thing. That's why they haven't got time. So they need to actually look at the change of approach to those teachers. And if you are able to convince them using not just the data but the practical, come and see it, now go back and do it, because you have to enthuse them. If the will isn't there, they're not going to make that. And I think that's one of the sort of big challenges for us in prevention.
I think that really, also, and I entirely get what you're saying, because I think that there's one more single thing that has got them to do this, and it goes like this. We haven't got time. Could you do between 4 and 6 focused lessons in 1 year, over the course of a year? And then if we draw the rest out through what you already do. And I always go, oh yeah, I can do that.
You break it down for them.
Yeah, little and often.
Yeah.
So everyone's clear, little and often, what they're doing, and that those little and often are absolutely focused, massively to the children, the young people that are receiving that input, and they're trained for it. Because confidence is another reason. I'm a tutor. I'm not. I'm not a social worker. Yeah. So hugely practical training, trained to what they're using, and that's made the difference. Right on the ground level, because you can get it all the way there, can't you? And then they just, you've got the horse to water and it won't drink, and they'll go, well, we might do it. So that's, I think, once you've got the senior leadership behind it, you then have to do a second way where you say, actually, I do understand what it's like to be a teacher, and your point about behaviour being improved and all of the associated learning that goes with what comes out of those lessons has another beneficial effect in learning to learn, being there, and that's all part of the same programme because it's broad. So I think kind of all of those things together, you get away from the panic and look at what can be done.